most detoxes from substances, and we're also talking about alcohol and prescription medication here as well, are safe because they are medically supervised. As in, the patients generally are detoxed in hospital with medication to help alleviate any of their discomfort, as well as any of the other more dangerous aspects to withdrawal that may be there. When we speak about drugs in general, to detox from drugs may be unpleasant, but it is not dangerous. However, when one looks at alcohol and prescription medications, these are very, very dangerous areas for detox. And in fact, patients can die during alcohol detoxification and during prescription medication detoxification. So for people that may be watching or people that may be interested in this particular area, I personally do most of my alcohol detoxifications in the hospital, simply for patient safety. It normally takes place over about 5 to 7 days, and the vast majority of patients tolerate it very, very well. But detoxification is only the first step, and I think a lot of people get into a false sort of sense of security or false sense of reality that if I detox from this drug, then I'm going to be cured. But the more that we know about addictions, the more we realize that this is actually a brain disease. And to eliminate the cause of the brain disease doesn't necessarily give the brain enough time to recover. And what I say to patients is that it's difficult to detox by yourself. It's very easy to detox with supervision. And no good doctor would do any treatment or intervention for you that is going to be dangerous or that is going to put your life in jeopardy. When it comes to alcohol detoxification, certainly there are people that are more likely to have a dangerous detoxification than others. And generally we tend to be more cautious and most cautious amongst people that are elderly, people that have got other medical conditions, people that have had a poor history of detoxification in the past, or people that have had a history of withdrawal seizures. And we have to very, very carefully identify those patients, because for patients that are the most high risk, there is no other alternative than an inpatient detoxification. The same applies to benzodiazepines, which are sleeping tablets, tranquilizers, drugs like Valium, lorazepam, oxazepam. Anything with a PAM at the end would be considered a benzodiazepine. And similarly so there. Quite often patients have been using these drugs for a very, very long period of time, and to immediately and abruptly discontinue those drugs can leave the brain in quite a hyper-excitable state that can itself give rise to seizures and delirium and such and such. When we compare that and contrast that to other drugs, like if we look at heroin, for example, heroin detoxification is very unpleasant for patients. It is physically harrowing, it's psychologically harrowing, but not dangerous. It is not something that is going to result in a fatal incident. So in those cases, we just generally institute supportive treatment. So painkillers, stuff for your runny tummy, stuff for your nausea, stuff to help you sleep, to help you get through those initial phases. If we then look at other drugs, for example cannabis and cocaine or methamphetamines, there are no clearly defined treatments for those withdrawals. So essentially it is really just an observation and supportive care and supportive treatment for those patients.